What's up, everybody, and welcome to a special edition of presented by Conversation Corner, COVID-19 2020. Today, I have three special guests that will be sharing their experiences and knowledge to hopefully help you, the community, to educate about this COVID-19. Today, I do have Dr. Liliya Anderson. How are you doing today, doctor?
Hi, I'm good.
Good. And I have Caleb Johnson, part of Hello World. Caleb, how are we doing today?
What it do, baby? Yes, sir.
Good to see you. And then we have Mary Meechan, who was a person that was gone through the COVID-19 and just recently was released from the doctors to be able to get back out there and would like to share her story. Why don't we start there? Mary, we know that you just, like I just mentioned, got through COVID-19. Why don't you talk a little bit about your experience and how did you know that you had it?
Well, I started getting sick. It felt like a flu. My body was hurting. And then the next day, I started having a cough. And then the next day, I was having cough, nausea, upset stomach, dizzy. And my friend, actually, she was the one that pushed me to go to the doctor. So I went into work. And I was like, okay, I don't feel good at all. So let me go to the emergency room. And when I went into the emergency room, it turned in, I had a fever. They were going to test me. Then it turned in, they thought I had pneumonia. So they did x-rays. And then my blood pressure was 176 over 126. So they told me that they couldn't release me because they didn't know what was going on. And they started doing EKG, found out that I had a mild heart attack.
Oh, wow. So because of the COVID-19, they say that was part of the reason for your heart attack?
I'm sorry, you broke up?
Oh, no, I was saying that because of this COVID-19, that was a correlation to your heart attack, the mild heart attack?
That is what the doctor told me, yes. And I have to go to see a cardiologist now.
Oh, wow.
So I have I have to go. I have a doctor's appointment next Wednesday. And so it's a concern, like, did it affect any of my other organs? I had to be retested. A lot of people ask, do you need to be retested? And it's been back and forth. Some people say, no, you don't need to be. But I went and I got retested. So, because, my parents are 73 years old. I have three young kids. I mean, they're in their 20s, but still, I don't want to affect anybody else and get them sick, because I know where somebody had came into my job that was positive and didn't let us know. So I know where I got mine from.
Gotcha. Now, Caleb, I know that you had recently had taken a tour with United Memorial and spoke with Dr. J. Why don't you tell us a little bit about your experience of this tour that you took at United Memorial?
Well, the experience was pretty crazy because I was one of the type of guys that believed in the virus, but at the same time thought it was equivalent to the flu. Until I got the call to come up there to use my platform to spread awareness. So his name is Dr. Joseph. Finally got his name. So Dr. Joseph with United Memorial got in touch with me, a videographer named Q, rapper Paul Wall, and Tommy. I forgot the name of the organization. But through the tour, we got fully suited up. I'm talking about layers of hospital clothing, the whole PPE, the mask and everything, double gloves, double shoe covers, and we had to get tested twice. So blessings that I came back negative. And the crazy thing was, out of us four that went, one guy had COVID-19, and it was just crazy. It was the videographer. So the experience was just like, wow, I've been shaking this dude hand, dapping this guy up on the way into the hospital, and he has COVID-19. But from what the doctor said, he was over the hump. He was like 9, maybe 10 days in, and the only symptoms that guy had was headaches. So my belief was still kind of, okay, this is, this is like the flu. Look at this guy right here. I don't got it. I tested negative, but that was just right there. Until we got into the heart of COVID-19, when I seen people of all ages, 18, 20, 30, all young people, all the way to somebody to the age of 70. When I seen a guy that was in his 50s die in front of us, man, bro, it changed my whole concept. The guy couldn't breathe, and every time somebody can't breathe, they always put him on their stomach. So from what I learned, it's not the virus that's killing you, like the doctor said earlier. It's the inflammation. It's what's clogging your lungs from what I experienced there. And that guy was dealing with that right now. I mean, and then from there, we met a family, a mother and her two children. And the mother was probably in her 50s. Her kids one was 20, one was 30. They all had the virus a day apart. The mom caught it the next day. The son caught it the next day. The other son caught it. So it was just seeing how they fighting through it, how the mom recovered a little quicker than her sons, and what they went through and what they said, and just, man, it just shook my mind. You know what I'm saying? So this documentary is pretty much gonna show the heart of COVID-19, pretty much what we experienced, and to put a message out there to the people that don't believe, that don't want to wear the mask, or think it's just another fad that the government doing. This stuff is real. You know what I'm
It is
saying?
absolutely real.
Yeah,
And you know, it's
real.
crazy to me. I still have chest pains, even though I've been
Yeah, chest
released.
pain.
Yeah.
That guy had chest pains. He had headache. He had a lot of phlegm. Uh, Definitely was hard to breathe. And I remember he didn't have no taste.
Yes,
He
I went
couldn't
through the same
smell.
thing. You lose
Yeah,
completely your whole taste, and it's crazy. You know, I don't know how to explain it. Your body just feels like it's just been beaten. You know,
yeah.
you I couldn't get up. I did not want to move. Nothing.
Well, you two have brought up some great, interesting information. Let's go to Dr. Liliya Anderson, and maybe she can enlighten us a little bit more. Dr. Anderson, why don't you tell us a little bit where you work and what you're seeing?
Yeah. So I work in Houston, which is a hotspot right now for coronavirus. I'm an ER doctor. So I'm on the front lines seeing all these patients coming into the ER, and it's been pretty crazy, especially the last month, I guess, has been a lot of COVID. So basically, initially in April when we were all doing quarantine and people were on lockdown, businesses weren't open, we were seeing some COVID, but it wasn't a lot. It wasn't a ton. Those patients were still sick, but it wasn't a ton. And now it's our entire waiting room. Like 80% of the patients are coronavirus, and our ER is full. And not just our ER, every hospital in Houston is full. So if I need to admit a patient, and I have to admit a lot of them, and our hospital is full, we call around all the hospitals, like Alden Memorial Herman's, Atlas St. Luke's, Methodist, UTMB, all the surrounding hospitals within like 150-mile radius even sometimes, and they are full. They don't have any beds, so we just keep them in the ER. Their admission is in the ER until at some point, maybe even 4 days down the road, a bed opens up upstairs and they get a bed upstairs. So it's been very, very busy. People are very, very sick. I'm seeing lots of young patients. I mean, I do see some older patients, mainly people from nursing homes that have that exposure to other people. I feel like a lot of older people, especially with medical history, they try to stay home and not be around anyone that could bring in the virus. But nursing home patients, don't have that luxury, of course. But younger people, they're still going to work, they're going to the stores, out to dinner. Some of them are actually, going out to the club or traveling and being a little more, careless, just because they're young and they just feel like it's the flu and it's not going to affect them that bad. And, if they get a cold, it's fine. Like their body will handle it. But I'm actually seeing a ton of young people that need admission because their oxygen level is low and they're not doing well. And as Mary has talked about, you get body aches, shortness of breath, chest pain, headaches, diarrhea is a big symptom that a lot of people are having, sometimes just diarrhea, abdominal pain, fevers, of course. Shortness of breath is really the worst one, of course, because how do you treat that at home? You need oxygen. So it's been, I mean, really this last month has been very eye-opening because we've been seeing so many young people that are so sick and even dying. I mean, I've had patients in their 40s, young 40s, no past medical history, die within 24 hours of being in the hospital. And they're still in the ER bed that they first came into. They didn't even get a bed upstairs. I've seen just recently, a female my age, young, healthy female, come in and just code as soon as she hit the bed in the ER. I mean, literally lost her pulses, coded twice, has 4 kids at home. It's just no medical history, no asthma, nothing. Like it's crazy. And now that we're learning a little bit more about it, we're realizing that it's more of a, rather than just like a lung disease or like a pneumonia, it's more of a vasculitis. It's more inflammatory disease of your vessels, and vessels are everywhere. So a lot of different parts of your body can get affected. So Mary, you said you had a mini heart attack. I'm guessing your troponin was high, which could be like a myocarditis, inflammatory response of the vessels of the heart or of the muscles of the heart. Another big thing that we're seeing, which is actually fairly common with this, is with having COVID, you're at a high clotting risk. So we're having patients come in with clots in their legs, clots in their lungs. And it's hard to decide for some of those patients because they're already short of breath. How do you figure out which one has clots? I had a patient that came in, also young, also my age, also no medical history, has diagnosis of coronavirus for like 2 weeks now. Just cough wasn't going away. There was a couple symptoms that were a little bit different. So of course I did a CAT scan on him, huge clot in his lungs. I mean, for that you have to get admitted and be on blood thinners for at least 3 to 6 months. So I've been seeing that a lot. And I think my big thing is to people who think like they're young and they're not going to get sick. Number one, you can. Sometimes people have very mild symptoms, but sometimes people get really bad symptoms and need admission, just like Mary did. And even if you're not getting that sick, you're still at a high risk for developing a clot because it's an inflammatory response. So it's a very dangerous thing that can happen to someone who is low risk,
So
Well,
a question, do you need to worry about clots? Like, for example, even though I've been released and I tested negative, is that something that I need to worry for?
I honestly don't know the answer to that because it's so new. I don't know what the clotting is for when you're already don't have COVID. Like if you have any kind of residual inflammatory response, I guess. I think it's more linked to your actual inflammatory response during the infection. So I'm hoping that once you're clear of the infection, you're not a high clot risk, but could you have developed a clot in your legs during the infection and you haven't noticed and then it goes to your lungs? That can happen. So things that you need to watch out for are swelling in your legs, pain in your legs. Usually it's one side that'll be swollen or painful, and would need to get like an ultrasound to assess for clots, because what happens is clots form in your legs and then they shoot up to your lungs, and that's deadly. So I would just pay attention to those symptoms. I'm hoping and I'm assuming that once you don't have COVID anymore, hopefully the inflammatory response is gone. And if you haven't formed a clot, hopefully you don't. But I don't think we're there yet to say that we're in the clear because we've only been in this pandemic for a couple months,
Right.
One, I've seen that people are going to these test centers that are being erected around different cities. And I most recently heard that they're doing now saliva testing. Is that as accurate as doing a nose swab? Do you know? And why, if it is as accurate, why does that only take maybe 48 hours to 72 hours of getting a result compared to getting a nose swab that takes up to 7 to 10 days?
Yeah, well, first of all, the nose swab, it can take 15 minutes. I've had a coronavirus test and it took 15 minutes. And that's who's running the test and how quickly they're running the test. Usually the ones that are like, hey, it's 7 days until you find out, that's because they're just backed up. A lot of community testing sites are the long ones just because they're seeing so many people. I got tested at like a freestanding ER here, and it was like 15 minutes. So you have to just call the facility that you're getting tested at, and they'll tell you how long. As far as like saliva versus nose, I don't think development.
I'm sorry.
Things are changing every
I'm
but
sorry.
so
You kind of you froze up for a moment. If you could repeat that answer, please.
Nope.
Hello. I'm sorry, guys. Got a little technical difficulties here.
me now.
There we go.
Okay,
There
I see you
are.
now. Okay, I see you now. No, I was
All
just
right.
saying that basically, the only like proven method right now is the nose swab. But of course, things are changing every single day with the technology they're coming out with. But really, we have noticed that the swabs we were doing at the beginning of the pandemic weren't very legitimate, because if you're just getting swabbed like here, it's not a legitimate sample. They have to take that Q-tip and they basically go through your nose and touch your throat. Like they go through your sinuses. It's not very comfortable, but that's how they're getting like a good sample. So to say you can just like spit some saliva in something and test for that, you could get a positive, but you might get a lot of false negatives, or false negatives too. I'm hoping,
What about if they
I'm
draw
hoping they
blood?
come out with a better test, because I think a lot of people don't want to get tested because it is a little bit painful. It's not very comfortable.
They told me they have to leave it there for 15 seconds. Do not move. Do not flinch. I was like, oh no.
It's not comfortable. It's really not.
Kayla,
So let me
were
ask
you
you this. What about blood? What about drawing blood? I got my blood drawn.
Yeah, that's for antibodies. That's to see if you have had it. That's to see if you have had it before and maybe you were asymptomatic. That means without symptoms. So if you've had it before and you formed antibodies to it, that's what that test is for. The only one that says if you are currently having an infection is the nasal swab. And it sounds like they're trying to come up with some saliva tests, but at our hospital, we are not doing that yet, because I don't think that's been studied as well, you know?
Well, and speaking of staying safe, I've begun to see a lot of people just covering up with all sorts of things to cover their mouth. Maybe you can debunk some of the myths about what works, what doesn't. But I've seen like almost sheer nylon looking things, bandanas. What is your opinion about the proper way of covering up?
Yeah. Well, first of all, if we're going to talk about masks really quickly, I just want to say how they work. So for a patient who is infected or an asymptomatic carrier, wearing a mask for them catches all their droplets. When they talk, when they cough, when they breathe, it catches all their droplets. So it decreases the transmission rate to another person by like 70%. So that's like the big important part of wearing a mask, is not to get other people sick if you're an asymptomatic carrier. It does protect you also, not as much as an N95 mask, but it does protect you also like 30%, right? If you're in close contact with someone. So if everybody is wearing a mask, it's a much, much lower transmission rate of the virus. That's why we want people to wear masks, because I don't know that I don't have it right now. I see COVID patients every single day. I don't have any symptoms, but what if I'm an asymptomatic carrier, Unless I'm getting tested every single day, I don't know if I have it, So that's why it's important to wear a mask in public, is to protect other people, to protect yourself too. But a lot of it is protecting other people. I know a lot of people talk about that when they wear the mask, they can't breathe. I wear the mask for 12-hour shifts, seeing patients. You can breathe through it. It does not make you collect CO2. The masks are not airtight. They just catch droplets. The ones that are tight and that is kind of harder to breathe in are the N95 masks, because air doesn't leak around it. And so those are a little harder, but I wear that also for 12 hours straight. So if we can do that working, if surgeons can do that while they're operating, trust me, like you can do it for an hour at a grocery store. You know what I mean? As far as which masks to wear, I have different masks. I mean, I have like the masks I wear at the hospital, like the blue ones, the kind of disposable paper ones with the filter. I have some fabric ones that are thick fabric. Of course not. I mean, if it's like see-through and it's nylon, it's not catching your droplets. It should be like a thicker fabric. Sometimes if you buy a mask, they'll have like a filter sewn into it or have a pocket for a filter. But the big thing is to catch your droplets. Unless it's airtight to your face, that filter, it's important, but it's not working as an N95 mask. really it's have it fitted well. If you need to twist the ends before you put on your ears, it might like form it to your face a little bit better. But really it's just catching your droplets and protecting you from other people. Another thing that I think is really important is what we've been seeing is patients that are around an infected person for 15 minutes or more unprotected. That's when we're seeing a lot of transmission. So I will say, if you are just make quick contact with someone and you're just wearing a surgical mask and not an N95, or if you're not wearing anything, that doesn't necessarily mean you're going to get it, but it's an airborne disease. Now we know that really the main transmission is airborne. It's still contact. You should still like wash your hands, of course, but it's an airborne disease. So if a person that's infected has been in a room, their aerosols are in the room for hours to come. So you could go into Target or like a fitting room or something like that where an infected person has been. There's nobody around you and you could still get infected because their aerosols are there. So that's really the scariest part, and that's how it's spread across the world so quickly. Contact diseases, they don't spread this quickly, especially if people are trying to take precautions with gloves and hand sanitizer and washing their hands. It shouldn't spread this quickly. This is airborne, and that's why it spreads so quickly.
And can you test positive again? I'm sorry to interrupt you.
Yeah.
I'm sorry. Can you test positive again? Can you catch it again?
Yeah, so of course they're doing studies on that right now too, with all the antibody testing that they started doing maybe, I think 2 months back, they started testing for antibodies. They're saying now that they think that you maintain your antibodies to this virus for 3 to 4 weeks. So after that, it is possible that you could get sick again. Of course, time will tell. We'll have more research, but they're saying that they've noted that the antibodies might go away within about a month.
Oh, wow.
And
what is the aftermath of it for your body?
I guess it depends on your course. I mean, if you had, I've had patients or friends that have had a 3-day course, some headaches, some fever, and then they're fine. They don't have much aftermath. They felt okay to begin with, like the flu went away. Right. Of course, if you're intubated, a lot of the patients that are not breathing well, are, BiPAPs aren't working, high flow isn't working, and they need intubation. A lot of times they stay on that vent for 2 to 4 weeks. Like, it's not as quick as intubation for a pneumonia for a young person. Be really sick and septic. Those usually get extubated, within the week. But a lot of these COVID patients are needing ICU admission and intubation for a month. So if you can think about, you're on sedation medicines because you're intubated. You're laying in a bed. You're not moving your arms. You're not doing physical therapy. Think about how weak you would be if you just laid in bed for a whole month and then you tried to walk afterwards. You know what I mean? Think about like astronauts that come back and they haven't been using their muscles and they can't walk. Like, you'd be very weak. You'd have muscle atrophy. But that's like the physical aspects of it. Of course, the people that are needing intubation because they can't breathe, they're having ground glass opacities in the lungs, which is kind of like scarring in the lungs, and that doesn't just go away that quickly. So they can still have some scarring and some lung disease after they get sick. And I anticipate in the next couple years we're really going to be able to pin it down to see, are we going to get a whole bunch of people that now have like COPD or emphysema, they have like a post-COVID lung disease. That's, not something that's even diagnosed yet, but that might be the future for those patients that had really bad, lung disease during the virus. Of course, the inflammatory response can hurt your heart, can hurt your kidneys. Clotting can cause strokes, can cause heart attacks, can cause clots in your lungs. That can cause organ damage for the future, even after you've been cleared of the virus. So it's a lot of stuff that that can happen. Neurological issues. Yeah.
Okay, I'm going to open up a couple questions some of our viewers are asking. First question, though, I have this woman who says she is pregnant and was wondering if there's any extra precautions that she needs to be doing, and if there's anything known so far yet of any transmission from mother to her baby. Do you know anything about that yet, Liliya?
Yeah. So as far as like during childbirth, there's not a transmission of the virus like from the childbirth itself, like through the placenta or through like actually giving birth, but it's the having the baby in, like if you're positive and you're actively having a fever, has symptoms, delivering the baby into that environment, with the aerosols and everything like that, with the contact spread, they can get sick from that. Not necessarily from being like pregnant and transmitting through your placenta or anything like that, but during the actual act of delivery, after baby's born, they can definitely get it. So for COVID positive moms, I'm sure you've seen it like in news articles and things like that, where the mom delivers and they take the baby away. Like she gets 2 seconds to look at her baby and they take the baby away until mom gets better. And then, a lot of stories of like, 2-3 weeks later, they get to finally meet their baby, which is so sad that they haven't gotten to see him, but it's to keep the baby safe and healthy. But that's the precaution. And then as far as if you have COVID and you're pregnant, of course, I mean, most women that are pregnant are taking prenatal vitamins, so you're getting the vitamins you need through that. A lot of people will supplement with like vitamin D, vitamin C, but just check how much of that is in your actual prenatal vitamins and if you actually need more, and check with your doctor on that too. But the same stuff, wearing a mask, washing your hands, as far as treating, really, women that are pregnant have a lot of meds that they can't take because of pregnancy, but you can take Tylenol. So you have to treat your fever. You have to, because if you're pregnant and you're having high fevers, that can negatively affect the baby. So you have to stay hydrated, take Tylenol to treat your fever every 4 to 6 hours. I mean, really be on top of it. I think that's the big thing.
With you saying that, there was a couple of articles and people were saying that not to take ibuprofen because it makes it worse. There any truth to that?
Yeah. So I do see a lot more doctors giving ibuprofen right now. Like, say there's people that are allergic to Tylenol and they have a 104 fever. So what are you going to do, right? So
Right.
they will give ibuprofen. I think Tylenol is preferred. They will give ibuprofen. Medicines like ACE inhibitors, which are like lisinopril and allopril, and ibuprofen, they can increase certain receptors on your lungs that coronavirus basically can bind to. I don't know if that's like a simple way to put it, but basically they can affect your lungs and make the effect of coronavirus on your lungs worse, I guess is the easiest way to put it. There are studies that came out like that several months back. So personally, I try not to give ibuprofen unless I need to. And I don't think one dose is going to do it. If you're having a high fever and it's not responding to Tylenol or you're allergic to Tylenol, then yeah, I would do ibuprofen. Ibuprofen is also, by the way, something pregnant women should not be taking. But yeah, I don't know if primary cares are still doing this, but I know initially they were switching their patients from lisinopril to like other blood pressure medicines, just to make sure that they're staying safe. So.
Mhm.
Mm-hmm.
Now, are there any different types of symptoms that parents should be looking for their young toddlers compared to an adult? Is there just different signs, I guess, that maybe we should pay attention to more for kids compared to adults? I
mean, so kids, for the most part, tolerate it pretty well. For them, it can be like a flu-like illness, but I don't know if you've seen, there's some papers that came out saying that some kids are getting like a Kawasaki type syndrome with coronavirus. Basically, that's also like an inflammatory thing. And I actually just had a patient this week with Kawasaki disease because of COVID. So it presents with, fevers aren't going away for 5 days, a rash, really cracked lips, red eyes, swollen hands or like peeling hands, lymph nodes, like a strawberry tongue. A very classic presentation, and it's a weird thing that we're seeing Kawasaki disease type of syndrome with coronavirus. But I have seen that happen, and there's been some case reports of that happen too. But of course, I mean, same thing. Hydrate, Tylenol, ibuprofen, control the fever. And really the big reason for adults or children to come to the hospital is, they can't hydrate. They're really weak. They can't walk. They can't breathe. Those are reasons to come and get evaluated.
Gotcha. Well, we're going to just open it up to a few more questions. I know we got some other things that are, important coming up. Caleb, do you have some people that have some questions for Dr. Liliya before we let her go?
Well, one question I do have for me is, how many different versions of the coronavirus are there? Is it a certain thing as American version, European, Chinese?
I don't know if there's necessarily like by region.
Right.
Viruses in general mutate as they go. That's why when we get a flu vaccine, 1 year, the next year you need to have a different flu vaccine because the virus mutates. They just do over time. So they're saying that maybe the coronavirus right now is not the same as it was, 5 months ago when it was first just originating.
Meaning different strands.
Yeah, just because of mutations, which is hard because, we're trying to come up with a vaccine for it. So yeah, I wouldn't be surprised if it's mutating and is a little bit different now. Yeah, but I don't know if there's necessarily like different strands in like Europe versus, America.
All right. I'm going to open up to a few more questions. Mary, did you have anybody that had any questions for Dr. Liliya today?
I already asked them. Thank you.
Okay. Caleb, do we have any more questions for Dr. Liliya before we let her go?
Man, my phone blowing up. I'm sorry.
Yeah, I thought you had a bunch of questions. No, every time it vibrates, it goes to the screen. So,
sorry.
Well, if we don't have any immediate questions right now, I would like to wrap this up. But Liliya, do you have any last minute advice for the people that are going to be watching this today?
Yeah, I'm still seeing like a lot of people saying it's not a big deal, like it's a conspiracy, the masks are gonna make you sick. Like, please, enough with the conspiracy theories. The masks are not there to make you sick. They're there to protect you and your loved ones and people around you. Please try to limit your outings to things that are necessary. Maybe going to the store, grocery store, getting medicines, things like that. Being out and about, traveling, being, Sunday fun day, things that I personally love to do, but I haven't been able to do myself for a long time. All of that increases your risk and everybody else's risk. The more people are mingling and getting around, the more we're spreading the virus. Actually, it's been, I think it was 9,700 new cases diagnosed in Texas just a couple days ago, and it's just growing. I really don't know what the endpoint will be, because if you look at the curve for Texas, which is just where I'm at, but like every other state too, I mean, it's just skyrocketing. It shows no sign of stopping. And I think until we make some kind of change where people are, quarantine again, we have some kind of lockdown, some kind of restriction, it's just going to keep getting worse. And our ERs are getting more and more full, and there's just no beds. There's just not.
Yeah, I agree with that people need to be more aware of what is truly going on. But I do want to thank all three of you for coming on, sharing the information like you had, Dr. Liliya, sharing your story, Mary. That's definitely going to hit some chords with some people that are going through it. And Caleb, we look forward to this documentary that will be coming out to share the actual inner experience at these hospitals. Do you have a time frame of maybe this documentary will be coming out, or a platform that we can keep an eye out for?
I'm gonna post the videographer information and everything. I'll probably send it to you. That's who we waiting on. We waiting on the okay from the organization that called us entertainers in to be part of their platform. So that's what I'm waiting on now. But it also inspired me to probably do my own. You know what I'm saying? Because I don't like waiting. So I was like, okay, I know a lot of doctors. I just met this beautiful doctor right here. We can get something going, Nick, Mary. You know
Okay.
what I'm saying? And especially since we did that documentary, it was 2-3 weeks ago. that virus has mutated and updated its system a billion times already right now. So the information we probably go put out right now is probably old.
Right. Well, I do hope that this helps educate people to kind of open their eyes to truly what's going on in everybody's city, and especially here in the state of Texas. Again, I thank all of you for coming on today. Anybody that has any questions for any three of the people that were on our panel today, feel free to write those in and we'll get back to your comments. But the rest of you, enjoy your afternoon. Thank you for your information. And everybody, wear your mask.
Yes,
Wash
please.
your nasty hands.
All right, guys. Thank you for
Bye.
everything.
Yes,
Bye.
sir.